For the next presenter or speaker, let me introduce a little bit for Dr. Kashima. His biography. He graduated from medical school, Gunma University, residency at the Department of Ophthalmology, Gunma University, Japan, and he studied fellowship in Department of Ophthalmology, Gunma University, and class Oculo-facial clinic in Gunma University. Then he go to do the international fellow of Oculo-facial service at the Style Eye Institute at the UCLA. Now he is the open Oculo-facial clinic at the Gunma and Tokyo, Osaka, and Chiba. Please welcome Dr. Kashima.
Thank you. Okay. Thank you for kind introduction.
This is the mic for the audience.
Okay. Okay. This is not.
Yeah. Can you put this one in this one and this one? If you have or with your finger, that would be wonderful.
Okay.
This is. Yeah. This is like this.
Oh, okay.
So today, during the prepare the slide, we have met each other in the international conference.
Yes.
So that's a very good opportunity to know friends and have the special friendship with friends that love in this career the same, and the career route quite the same. We fight a lot initially, and so I heard from Duong that Duong have the get chance to visit Kashima last year for some short period visiting, and Duong told me that Kashima have the very good success in his career. Within 4-5 years, he had create about 4 very big office. So that's why he is a very interesting person. So I invite him, and he is so kind to say yes to share us about his experience. I think if we have the question, we can ask him. And in Thailand, it's quite unusual that one doctor heading to the private practice immediately. That's quite unusual for us. Most of us we work like for a private hospital. So it's a good chance that maybe today Tommy will inspire something inside us, and some of our new generation may have something to initiate like him. So thank you, Tommy.
Thank you very much. So thank you for very kind introduction for me. Let's start my talk. Is it okay? Okay. Good afternoon, ladies and gentlemen. And I thank Dr. Goff and Dr. Duan for inviting me to this lecture course. I like Thai people because they are nice and polite, and I like Thai food because tasty and spicy. So I love to coming to Thailand because please invite me next time too. So let's move on to the lecture. My first topic is how to initiate and optimize premium private oculofacial plastic clinic in Japan. So I have no financial disclosure. Let me introduce myself. When I was a medical student, I thought like this. Ophthalmology department in Gunma University is said to be a high level. I'd like to learn cataract surgery and vitrectomy at high level and start my own practice as soon as possible. This is a schema of sense of values in Gunma University. traditionally, the strength is on the retina and macular disease. The oculoplastic is the lowest. But I found that there was a very long queue to become a surgeon. If I use metaphor to mountain trail, it looks too long even to enter the trail. So I think, again, from the starting point, is this value true? So I switched to run oculoplastic, but when I wanted to study oculoplastics, senior doctor said to me, oculoplastic is too cheap. You should do cataract. Of course, I know all ophthalmologists think same as him. But I decided to become an innovator who can change the common sense. And also, I wanted to see further something below the lowest position. So I fly to Los Angeles, USA. This is a building we do operation and clinic. This building is donated by one rich person. In UCLA, I can get temporary medical license with which I can operate just under supervision of US doctors. This is a photo of my international fellowship in US. After my big jump to US, I realized I might have a treasure here. So please think, what do you think the underlying factors for success of clinic? I think like this. I think like this. There is underlying three factors: gathering enough and adequate patient, and second, gathering young doctors, and enough and adequate sales. So let me introduce our medical group. In 2017, I opened cutting-edge oculoplastic clinic, which is for only oculoplastic patients, excluding general patients. In 2022, we have 4 clinics in which do day surgery, including general anesthesia. And we perform 9,186 oculoplastic surgeries last year. 32 physicians, including 8 full-time and 24 part-time. How I do that? When you open private practice, you may think, I've studied a lot of surgical procedures, cataract, glaucoma, vitreous, and the more I can do all of them, the more sales I can make. But for me, it's wrong. The first, how to gather the patient. So, there are the common sense belief. There are 2 types of common sense. The common sense A is very old and common sense. Example, don't kill people. But common sense B, recent common sense. The example, keep telephone card in wallet. Young doctors never know this. So common sense B can change with time. What common sense do you have? The frog in the well knows nothing of great ocean. So what I value in my life? First, since common sense in the world does not always mean truth, I should go back to the starting point and think about it. Second, when making a judgment about something, it may be difficult to decide from my own standpoint. So replace myself with a different position and look at my own situation. My style 1, only do oculoplastics. So when I wanted to study oculoplastics, senior doctor said to me like this. And a clinic that only does oculoplastics. So change of standpoint. Please image the restaurant. So image the restaurant with a counter like this. So Thai food, Chinese food, Japanese food, Italian food, everything in the menu. Or only sushi in the menu. Do you think which restaurant is better? It's easy to see the analogy in the restaurant. Adding more items to the menu results in lower price and lower satisfaction. But reducing the menu results in higher price and higher satisfaction. So doing everything we can, your strengths. I recommend you focus on just one specialty, like chef and patissier. Do you know blue ocean strategy? The red ocean is an existing market and battle from market segments. The blue ocean is newer market and producing market segments without competition. So general ophthalmologist is red ocean for me. But oculoplastic doctor is blue ocean. In 2022, totally we performed over 9,000 surgeries. My style 2, many days surgery under general anesthesia. So we perform 1,199 general anesthesia cases. The average is 23 cases a week. Do you think it takes a long time to replace general anesthesia? The finish surgery to starting the next surgery, the staff have to do many things. But in my clinic, this replace is within the 15 minutes. So after the surgery, recovery room time, average recovery room time is about 100 minutes. There's no case of emergency transport due to the complication of GA. When we can use GA in our own clinic, so we can do all oculoplastic surgery by ourselves. So we do DCR, orbital tumor, orbital fracture, orbital decompression for thyroid eye disease, pediatric cases, collagen, epiblepharon, trauma. So ophthalmologists, general ophthalmologists are easy to refer us as if they are throwing out garbage, right? So how to gather doctors? Master 3, teach everything. So I have an experience in US. So as a Japanese who has experienced the world, I wanted to bridge the gap between medical care provided in the world and in Japan. So I want to make oculoplastic Japanese infrastructure. So feeling like a missionary, what can I do to promote oculoplastics? I'm thinking like this. The problem of children not growing up without parents, right? In Japan, the lack of doctors who teach oculoplastic surgery was causing the problem that no one could train the next generation of oculoplastic surgeons. So in Japan, there are many textbooks. Some of them edited by me. But you will never be able to do it just by looking at text and pictures. So oculoplastic education on the internet. I did oculoplastic education on internet. I thought that the greatest contribution to the society is to preserve the knowledge and experience on the internet and to pass it on to the next generation. So this is a ptosis surgery, a video for ptosis surgery, 25,000 times play. So true technique of collagen surgery, 92,000 play. Not only post-operative videos, but also a commentary. So explanatory video for scalpel and hemostats, sorry, in Japanese. Can I sound? No sound? Okay, is that okay? Okay. So I broadcasting like this to teach how to use the scalpel, and also how to do the hemostats. Yeah, I made the slides and recorded and broadcasted. So next stage, I made this one, explanatory video for thyroid eye disease. So 5 videos, not only videos of surgeries. The improvement of surgical techniques requires more than surgery, which means the assessment before and after surgery is most important key. Surgical videos alone would be one-sided. So we are doing web seminar in every 4 months and sending the flyer to all ophthalmologists in Japan. Maybe 10,000 ophthalmologists. So I made this video every 4 months. So, yeah. Yeah, this is a director of Oculo-facial clinic in Osaka, Masashi Mimura. He introduced the topic and lecturer to the audience. So recently, almost of all residents watch my surgical videos. They watch the video and they visit us and they want to join us. So my style 4, give everything to young doctors. So please think what they want. Doctors are very diligent people in general. Especially young doctors are diligent. So what they want is knowledge and experience, more than money. So to correct young doctors, we should give them experience and knowledge. So our style and my style, we tell the patients with insurance they cannot designate doctors. The surgeries of them are operated by inexperienced doctors. And many drink parties I pay. So how to make enough sales? So someone said, all that matter is sales. Is that true? Maybe true. So only 3 key factors of success. Number 1, patients know us. Number 2, young doctors know us. Number 3, general ophthalmologists know us. That's all. It's easy. So sales of our group, including 4 clinics, reach $1 million per month. So I want to make oculoplastics in Japanese infrastructure. So when I die, I want to be a missionary of oculoplastic in Japan and Thailand too. Okay. So this is the front entrance and the front of my clinic in Tokyo. It's like a museum. And this is operating theater. We have 2 beds and 2 microscope and 2 machines for general anesthesia. And this is also the entrance of the clinic in Osaka. And in Osaka, we have a very big operating theater, and we have 3 beds. So it is important to get at the well of common sense. It is always yourself who decide not to go. We are proud of high rating of us. Can you see the 4.8? Now decrease and 4.7. Sorry. So thank you for kind attention. We are proud of cosmetic orbital surgery, and we did over 9,000 oculoplastic surgeries last year. International fellows and visiting doctors are welcome. Thank you.
Thank you very much, Tommy. That's really so impressed.
Yeah.
And I think that's who inspire the young generation so much. And I think the first question to you, I have seen that you have got the PhD. What kind of PhD?
The system of university is different among the countries. So in Japan, the medical student get medical license, and then after that go to the how can I say, college again, and then get a PhD. So if you have a medical doctor and write a paper, so you can get a PhD. So it's very different from the US system. Yeah.
How many years that to take to get the PhD?
4 years. 4 years. Yeah. Normally.
You mean before the medicine?
No. After graduating. Yeah.
And Tommy showed us that he have a ability to go and break through the traditional system. That's really good, and I think it's a wonderful idea to do that. And for the young generation, what is your recommend if someone feel like reluctant to come out? Because some people, I have seen that many young generation, they are very good, they have a lot of idea, but they keep in their head. They could not go through the high fence that to jump over. I think once they have some trigger that inspire someone to jump up across the fence, they can go through up the mountain easily, like you, right? What inspired you initially to jump over the fence? or you have the idea since you was medical school, or during you train in residency in Japan, or when you was in US? When?
Originally, I have some kind of talent like that. So I'm very good at doing the kind of innovator thing. And actually, innovators have a very opposite opinion. So Yeah, like you, maybe, yes. I'm not sure. But all the innovators have some kind of opposite opinion, right? So I have to say to young doctors is maybe somebody want to stop your decision. It may be it is for him or her. That opinion is for him or her, not you. If the person who will promote you to go out is thinking about your future, very different. So there are many opposite senior doctors, maybe, but it's good because there's no one.
I am pretty sure that during your starting your career, you may have some difficulty
Yeah.
or some resistance. How can you overcome any resistance, and how can you want that?
Yeah, yeah.
A very difficult question, right?
Yeah. It's easy to answer in Japanese, but I think the circumstance is slightly different in Thailand and Japan. And yeah, I'm a kind of genius. How can I say? So I think about the rule in the world, or yeah, among the people in public. So I want to find out the rule. So when I found out the rule, so I just follow it. That's all. I don't follow the senior doctors. That's all.
That's a very good answer.
Yeah.
And I think Tommy is a very good example that he can something like show that he learned every day, right? He learn every day and he come and innovate every day, nearly every day. I'm pretty sure. Yeah, and when he do his job, he introduce his idea, his share the concept, the knowledge. I think I have seen something that the more he share, the more he get. Not only the money, not only the reputation, but everything, right?
Yeah.
Everything. We cannot imagine how far he can go.
Yeah.
And that's a yeah.
I'm studying from this situation. Of course.
Yeah.
This is great. Right?
Right. I have seen some because when we start the clinic, basically I think initially for every eye doctor, it's very difficult to start his solo private practice by himself because we're not rich. We're not that millionaire. We have no money at the initially when we start, right? But if someone is going to be the son or the daughter of the millionaire, that's easy. But we are not. I'm not. Nah?
I'm not.
Yeah, but I ask you, how can, because you use a lot of money at the initially, how you set up the system, or you have your own money, or you have to loan or something like that?
Yeah, I had a big I have a very big money of loan. So actually maybe over 10 million USD dollar I have. So
To loan?
Yeah.
For the first one?
No, I mean total 4 clinics and my home maybe.
Right.
But it's okay because it's the business of bank, so it's not my business.
Right.
Yeah, so they take some money from that budget. Yeah, from that loan.
Right.
That is their work. When I die, it's free. So I don't afraid. I never afraid. Yeah.
Tommy is a good example again about he can do the very good surgery. He is a very good physician and surgeon. At the other part, he is a very good leader for his own business also. That's very important. It's very hard to find one doctor that good in surgery and good in leader in the business. Nah? So I think that's a very good example. Yeah, yeah. I hope this one gonna be inspire all of us, nah? All of us to have your own. I do encourage. If I talk to my junior or my younger colleague, maybe ophthalmologist, specialist or general, I think if you have the chance, you should open your own.
Oh.
Yeah, that's better. You think you're right?
Yeah, from my point of view, if the young doctor open their own private practice by themselves, that traditionally it's a kind of rule. But the problem is we cannot see the connection from the public, right? If you grow up one doctor, and he or she is very good hand, very good hand, but no one knows that doctor connect you, and you are the teacher. That's a problem.
Right.
So I think young doctors should connect to the teachers and the groups. So I want to connect whole doctor. Like my fellows, my students, connected to my Oculo-facial clinic group.
Right.
So I want to give them almost same name of clinic.
Right.
Yeah, or give the branch
Right.
as a director.
Yeah, and let me ask about the fellow. The fellow is like come and learn with you.
Yeah.
How many years for the program? And I have seen that you accept the international fellow also. That's a very good idea. That's a good idea because when we are from the when we was finished graduated, we go to US.
Yeah.
If our mentor in US not allow us for the spot to get the training, we have nothing. So he has a vision. He has a vision to train someone, and with someone maybe from not in Japan, outside Japan, come to train with you, and then they came back. They come back and they go up their own practice like you.
Yeah.
That he has a vision.
Yeah.
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 How can tell us about your training?
Yes. For international at first, I'm very welcome because I was Los Angeles, and actually I got money from how can I say that donated money every month. So in LA, international fellows have a salary.
Salary,
money. Yeah. Very good. So I was very surprised. The one rich person, U.S. people, right, give us money, just international, and go back to our home country.
Right.
Why?
Wow.
I cannot understand. But they give us money. So I think I have to pay forward. That's kind of good sense. Will. So I think my clinic is very welcome to international visitors.
Right.
Yeah. So actually from Duan sent me maybe 10 students. Yeah. After that.
After this,
like you.
After this.
Yeah. So it is interesting, and for me it's informative. Yeah, I'm very welcome. So if they're interested in the visiting to our clinic, they are welcome.
And last question for me.
Yeah.
Can you tell us about your perspective and your idea about training? How important for the education training
Yeah.
in private practice?
Yeah.
How important?
Yeah, it's very difficult, right? Yeah, the young people, I always use analogy. I always think surgery is Mario Kart. Do you know Mario Kart? Yeah. At first, you run the course. You cannot go through directly. Maybe go fence, go and then several times after you can go very quickly. So surgery is almost same. So young doctor have to make complication. It's very difficult problem. Different from the cataract, oculoplastic is kind of possible to recover, right? Cataract surgery is very difficult to recover. So that's the point. I can recover almost of the mistake. So yeah, I give a patient to young doctors. Yeah, I always give. Yeah, that's why I gather the young doctors. Yeah.
In Japan, is there any, I would say, institute,
Yeah.
institute like this in system of the medicine of Japan, or only you? None?
Oh, only me.
Wow. How about in other specialty like dermatologist, general surgeon, or medicine, something like that? Or no? Wow.
I don't know that.
Wow.
Yeah,
Wow.
institute.
Wow.
So,
That's amazing. That's amazing. Yeah, question please. Dr. Kanchana first.
Since you are a pioneer of this, is there any resistance on the conservative, like the institute, the main institute? Is there any resistance for this thing that you're building?
Yeah, actually, this is kind of oculoplastic is kind of blue ocean. So there's no senior, rare doctor exists, but very rare. So almost no. But actually, how can I say? From the main meeting, like AAO or from main meeting, I was kicked out. Yeah, I can submit the papers, but they never invite me as a lecturer. Yeah. Simple this like that.
I mean, international or national?
National. International, yes. You invite me, like always. I attend international meeting. Yeah.
And also, next question. Since you're like work as a group practice, how can you recruit a new generation as your physician, the oculoplastic surgeon? How you I mean, like the one that you have to work with, or you give like the directors the position for them to take care of your branch. How can you be so sure, and what is that the idea of you to recruit the person?
I presented in the lecture. Yeah, I'm doing the YouTube, and I send the flyers to all ophthalmologists. So they watch the YouTube or flyers, and then, yeah, I think many young doctors want to come to see our clinic. But the part of that people we gather. Actually, every week, some visitor visit us. Yeah, every week nowadays. So maybe 5 years later, the physician number will become very high.
But they're visitors. But how about the person who work with you?
Work.
Working together, right?
Yeah, almost doctor is not so bad for the techniques. So yeah, I can teach them, and the student become a kind of good person to teach. And then nowadays, I have a apprentice, okay, fellow. Yeah, like that. Yeah, keep making the next generation. Yeah. Is that point?
Yeah.
Yeah.
Thank you.
Another questions. I want to know about the normal general of the patients who come at the first beginning that you was setting your clinic. Is that what type it is of the patients? I mean, self-pay or government reimburse or insurance? Mostly because it's a private clinic, right?
Yeah.
Yeah.
So the insurance system is different among Thai and Japan. So in Japan, the private clinic can also have an insurance system. Same
I know.
among the hospital,
Right.
public hospital, general government hospital, all
Yeah.
same. In the same insurance.
So the insurance, that means like a government reimburse or like a private insurance.
Yeah,
That do you mean?
government.
A government reimburse.
Yeah, in Japan,
Uh-huh.
all people have a government
Yeah.
insurance.
All papers.
Oh.
Okay. Yes.
Yeah. So in my system,
Yes.
the patient with government insurance is operated by fellows. Only the self-pay patient, I do surgery.
Oh.
So patient decide.
All right.
Okay.
Uh-huh.
So
Okay.
maybe 6% of my clinic
Yes.
is self-pay.
60%.
60
Yes.
in Tokyo.
In
Sorry.
Tokyo.
In rural area, it's very different.
All right.
Yeah. Only in Tokyo.
Right. Okay. Got it. I got it.
There's
Because
very
we
many
take
complicated
care Japanese
person.
patient also in Thailand, and most of them have like governor reimbursements, and they can use for all disease maybe just 6 months in the same disease, but if it not improved, they may have to go back to Japan to get the treatment. Right.
Yeah.
Right. Something like that. Yeah. That I have heard. Yeah. Thank you.
Thank you.
Please excuse my voice. Just one quick question. In Japan, is it required for doctors to have, let's say, if you want to do blepharoplasty or some orbital surgery, do you have to have some credentials after ophthalmologist to be able to perform those surgeries? Or you can just maybe go to a private practice fellowships like the one you created and go perform those surgeries? Or is there like an institution that governs this?
Sorry, I cannot understand that. Sorry.
Like, can general ophthalmologists, like all of
I
them,
think
if they are
is too far.
if they are confident in their abilities to perform the surgery, can they perform those surgeries? Let's say blepharoplasty or orbital surgeries, or do they have to go through some kind of certification that is regulated by the government before they can perform?
No. The patient can directly come to my clinic. Just skip the local ophthalmologist and yeah.
Hi, doctor. The ophthalmologist, the general ophthalmologist, is able to do the orbital surgery.
Oh yeah.
Japan,
If
or do they need a fellowship certificate?
no. But if they can, they cannot.
But do patients usually ask for like those credentials? Like, oh, do you have a fellowship in this, or do you have a certification in this before they allow you to operate on them?
In Japan, no patient knows that kind of system. So maybe some doctor do, especially plastic surgeon do. if he is inexperienced doctor. Yeah, yeah. So that's make a problem. Yeah. And the general ophthalmologist always refer to the specialist. That's why I can gather the patient. Yeah. General ophthalmologist never do that orbital surgery or lacrimal surgery or the surgery they cannot do.
Now asking for
No.
asking for maybe future Thai fellowships, like future Thai ophthalmologist who wants to go to Japan
Yeah.
and learn from you. Is there any test or anything they have to take before they can go learn from you in Japan?
Nothing, but I need recommendation letter from Duan or Golf or you.
Only three?
Yeah. But
So
I'm
they
sure.
they don't have to
One?
take like new medical licensing examination from Japan to be able to perform the surgeries at your clinic?
no. I could get a license from U.S. government in UC area, but it's very special. Only in UC area. It's same as in Japan. We cannot give a medical license, so you cannot do surgery, even do one. Yeah. Just observe. Yeah.
Okay. Thank you.
Okay. Yeah.
Hello. Could you hear me right? Okay. I would like to ask about the general anesthesia that you mentioned that you perform in your clinic. Do you have to this only IV sedation, or they have to face mask to sedate the patient, or do in your clinic do you have anesthesiologist to cover them, or just you take care of the patient?
Only the doctor for general anesthesia is do general anesthesia, and for local we do sedation by myself.
Okay.
Yeah.
So the all this IV sedation, you take care of the patient and they go
Yeah.
back to
Yeah.
no inpatient overnight.
No.
Okay. Thank you.
Yeah, just outpatient.
Thank you so much.
In Japan, it's difficult to get a new bed, inpatient space. It's kind of impossible. So there's very many hospitals, and it's a problem for government insurance. Yeah, they get money, from government. So the government want to reduce the number of beds. Yeah.
Thank you so much.
Yeah.
Thank you.
Mommy, do you have fellow from another country? Beyond Thailand, Japan, any country, Africa,
You
India,
mean-
China, you have
Federal?
fellow, visiting fellow.
Oh, yeah. The one is.
Osaka.
Yeah.
Observing for 1 or 2 weeks.
Yeah.
Can Thai fellow,
Yeah.
Thai visiting fellow,
Yeah.
scrub him and go to the operation room or just observing?
Yeah, just observing. Yeah. It's difficult to do surgery. Yeah. I want to give them surgery, but
I think it's when we if someone have the ability to
Yeah.
see,
Yeah.
understand,
yes.
think, come back and read
Yeah.
and do by yourself.
Yeah.
That's the best way to learn.
Yeah.
That's the best way. And it seems that you work so hard. You have 7 days a week, work 7 days a week,
Oh no, just 5 days.
5 days. Oh.
But usually I do the other work in rest of the 2 days.
And you have so many for office. how can you separate yourself to go which one?
Of course, I give them for that. Gave the clinic to the director. So I don't do anything for them. Yeah. Just controlling the staff or drink party. Yeah, I will make.
It's really, very, very informative and very precious. Discussion very fun though.
Okay.
And any question, please? Yes, please. Mom,
Okay, I want to ask you about the situation of the oculoplastic patient, the patient that have oculoplastic disease in your country, because I think maybe like in Thailand, many ophthalmologists cannot do the oculoplastic procedure, so many patients must wait for a long time, or maybe they must go far to the big town in Thailand to see the oculoplastic ophthalmologist, and maybe they must wait for years or 2 years to have some operation because the local ophthalmologist cannot do it. I want to know, in Japan, do you have this problem about your ophthalmologist in Japan?
So, when you visit us, we do like 10 cases in a day. It means 50 cases in a week. So every day I do, or in every clinic do 10 patients. So we never have waiting list. Every case coming to our clinic have a surgery within 2 weeks. That's our policy. So maybe 1 year, 2 year waiting list is too long. I had that, but it's the problem of system. So just do it. That's all. How can I say? Why so that circumstance will come? You do more. You should do more. No.
That's
Enough.
going to be my next question.
I cannot understand. Sorry. So, why do you make that kind of situation? So, you should do oculofacial clinic in Bangkok. So, that's my answer. Is that true?
And the patient that have oculoplastic disease in Japan, most of them refer to your clinic, like?
Because only how can I say? The rare doctor do real oculoplastics, right? The general ophthalmologist do oculoplastics, but it's not real one. It's not professional, amateur, right? So they know it. And I'm a specialist, so they should do cataract because they are good at cataract, but not good at oculoplastics. So if they understand it, they refer to me. Year by year, the many ophthalmologists refer us. So even 5 years has passed. My patient grow 20% every year.
So before you initiate your clinic, maybe the patient in Japan have no choice to have the treatment, like
no.
in an oculoplastic disease.
It's the same as cataract surgery. Maybe 20 years, 30 years, 40 years. There's no phaco. When there's no phaco, the indication is very low visual acuity. But nowadays, very good machine. There's a very good machine, and indication spread very much, right? And the number has increased. very much. It's the same. The technique grow and the indication spread. Right?
So I think now maybe you the idol for the young ophthalmologists to be the oculoplastic in your country.
Oh, yeah. But I think you should do same way as me in Thailand.
Okay,
Yeah.
thank you.
So there's so many questions.
Okay,
Yeah.
I think Tommy influenced us to think out of the box.
Yeah.
It's time to think out of the box.